just been impatient. Complicated situations got my time vacant, but I waited. It's part of my dedication. Continuation, trying to further my education. And I hope you want to see me grow.
Everybody, thank you for tuning into my channel. My name is Kiana. I am a registered nurse. I recently acquired my master's in nursing education, and now I am pursuing my PhD in nursing education. So I'm soon to be Dr. Murray. So if you haven't subscribed to my channel, go ahead and click that subscribe button. If you have subscribed, thank you for taking this journey with me. I hope the information that I provide is useful. Today, I'm going to be telling you the levels of a registered nurse, and I'm going to tell you about my experience in graduate school. So let's get right into it. So there are 3 levels of a registered nurse. You have an associate's prepared nurse, and in an associate's program, we take the same NCLEX. The only difference is the focus is more on technical training, so meaning like more skills and things like that. And then you have a bachelorette prepared nurse, and that's the most common one. And they pretty much, that's how everything was designed to be. In my PhD courses, I'm learning that when Florence Nightingale pretty much wrote her rubric for how to properly educate a nurse, that her intention was for it to be a bachelorette prepared program. So in that, there's more leadership courses. I believe that there's also more science. The requisites are all the same though. So pretty much if you go ahead and jumpstart your career in an associate's program, which usually takes about 18 months, then you only have to do the prerequisites. You only have to do the prerequisites for the program. Now, as far as the bachelorette program, you have to do the prerequisites in addition to your general courses. And so that takes a little bit longer. It usually takes 4 years. But what they've done is they have established a core curriculum that is all the same. So it's like a structured curriculum. So if you start ADN, then there are bridge programs that get you to your BSN.
The arrow is pointing to additional courses that are needed.
As you begin to work and gain insight on what you want to do, and if you decide to make the decision to further your education, there is a master prepared nurse. And so in that, those are going to be your nurse practitioners, your midwives, which check out the video that's coming soon. I actually had one of my friends who's in a midwifery program kind of break down what that program consists of. And then you have me, the nurse educator. And that's not all. I mean, there's multiple. There's psych nurse practitioners, there's pediatric, neonatal nurse practitioners. And so they are considered nurse practitioners, and they still hold the title of a nurse. And so pretty much what that consists of is getting your experience in whatever area you're going to specialize in, and then pursuing the program. So some are more, it goes back to the technicality of things. So some are more technical, and then some are more theory and research based. So the program I'm in, I have my master's in nursing education. I'm getting my PhD in nursing education. So it's pretty much the same thing. All of the beginning courses are the same, and then once you get the core courses done, you branch off into your specialty. So basically, the requirement was for me to work for 2 years as a registered nurse. It didn't matter what department I worked in, and then I also had to have a 3.0 GPA and a letter of recommendation. So applying for the program, it was seamless. I found a program that tailored to military members and veterans because I have my GI Bill, so that's kind of how I made my selection. You always want to make sure you're attending an accredited college, and then I went ahead and jumped into the coursework. So in the graduate program, it has been extremely time consuming. It's very doable with a full-time job, but you have to be very disciplined, dedicated, and things like that. Some things that came up that I didn't expect to have to do practicum for nursing education, because I was like, oh, well, this is, I thought that, I knew that nurse practitioners would have to do that, but I was like, why does a nurse educator have to do 200 practicum hours? And also, I had trouble securing my preceptor. So in that, I want you to be cognizant of that and make sure that as soon as you get in the program, or as soon as you make the decision, you start networking to make connections with people that are going to be willing to precept you and evaluate you, and you're going to get the maximum benefit of your learning. Because when I talked to some of my peers, I was telling them about my clinical logs and my daily experience, and everybody's like, what, you got to teach, you got to create a lesson plan? I'm like, yeah, that was in our course objectives. Like, yeah. that experience. So try not to pick your friends to do it if you really want to learn how to do your job. Go out and research. You can do a LinkedIn. You can just ask around. You can ask somebody from your nursing school. And so yeah, so pretty much it was very time consuming. It required a lot of time. And then we all have to take a health assessment course. So in that health assessment course, that's another thing you want to make sure that you secure a nurse practitioner or a master prepared nurse to evaluate you to do the health assessment course. Otherwise, you will not pass. So now, after graduation, one of the things I want to make sure that if you do pursue a master's in nursing education, make sure you get a letter of recommendation from your preceptor. So I've been applying to jobs, and one of the requirements that I've been seeing, I'm like, oh no, it's been like 7 months, and like I literally don't have a letter of recommendation from my preceptor. I've been doing per diem contracts like here and there. Don't forget to watch the per diem video, link in the description. And so it's been really hard for me to get a letter of recommendation. So make sure you get that before you leave. And also, I was shocked to find out that most nursing instructors actually don't have their master's. So if you want to be a nursing instructor, you actually don't have to have your master's, but you probably won't get a tenure position. So there are multiple types of nurse educators. So you have instructors, which are nurses that just have clinical experience and they kind of teach lectures like here and there, they're PRN. Then you have associate professors who are in pursuit of their master's in nursing education, and then you have professors who hold a master's in nursing education, and then you have tenure, and those are people that have their master's and are currently pursuing their PhD. So I'll let you guys know when I get a job which category I fall into. But yeah, I definitely think it's worth it, especially as far as like security, job security and things like that. And then self-achievement. I mean, I feel amazing that I went to graduate school and that I actually graduated and did it while working a full-time job. And now here I am in a PhD program, my second semester, and I'm gonna be a doctor. So once you go ahead and pursue your doctoral degree, I'm still a nurse, but the proper term for me would be Dr. Murray. So I hope that helps somebody on your adventure to go applying for graduate schools in nursing if you want to further your education, and especially if you go the nurse educator route. I hope I gave you some great tips on how to do it with ease and a successful transition from clinical nurse to novice nurse instructor. Thank you guys for watching. I hope you guys have a wonderful day. Don't forget to subscribe to my channel. Bye.